So, today we're going to be talking about AI versus physical therapist assistants. And my stance on that is that AI absolutely cannot replace physical therapist assistants, or most any healthcare profession for that matter. So let's dive into it. I want you to imagine you just had a stroke. You're nervous, in pain, and you're trying to take your first steps. Do you want a machine algorithm telling you how to walk? Or would you rather have a therapist, a trained professional by your side, encouraging you, adapting to your pain, and celebrating your progress? That's the reality behind today's question. Can artificial intelligence safely and effectively replace physical therapists and physical therapist assistants? My clear answer is no. AI can certainly assist. I think it would be a good complement, but it cannot replace us. And today I'm going to show you why. So, in the next few minutes, I'll explain why PTs and PTAs are irreplaceable by looking at these three areas: ethics and safety, the human connection, which I feel is super important, complex critical thinking, and along the way, I'll share evidence from peer reviewed research to back this up. To be fair, AI certainly has its strengths. So I think it could be an amazing complement to the world of physical therapy. It can analyze thousands of images much faster than we can. It can track patient movement with sensors. It can even generate exercise plans. So yeah, I mean, it could give them a plan of care. But a review by Lynott and colleagues in Frontiers in Rehabilitation Sciences in 2023 pointed out that AI has opportunities in rehab medicine, especially for things like gait analysis and predicting recovery timelines. But here's the catch: those same researchers emphasize the challenges. So, lack of transparency, limited data, and workflow barriers. And in other words, the technology is promising, but it's just not quite there yet. So, it's not a replacement for the professional at the bedside, and it never will be. Now, let's dig a little bit deeper. So, when you put AI in healthcare, the ethical questions skyrocket. So, who's responsible if AI gives a bad recommendation? Now, in 2024, an article in Helion and Manila and colleagues reviewed these issues and called them ethical and regulatory challenges. They found some big red flags. So, one would be transparency. Neither the clinician nor the patient might understand how AI came to that conclusion. So that's pretty dangerous in a field where number one, we want to do no harm. And also we're very big on building trust, and that's just going to tear it down. So also liability. If an AI tool makes a mistake that leads to a patient being harmed, who's responsible? Is it the software developer? Is it the hospital? Is it the therapist that trusted the AI tool? Who's to say? Um, so telling a patient, I'm not sure why the computer told you to do that exercise, but let's just go with it anyway. That's not very inspiring, especially when we're trying to instill confidence in the patient. So, this is why governance and oversight are non negotiable. Now, let's talk about something AI simply cannot replace. This is the biggest one for me, and it's human connection. So, PTs and PTAs were motivators, we're cheerleaders, and problem solvers. We help people improve their quality of life. And a big part of that is human connection. So, we don't just demonstrate exercises, we help people believe they can recover. And that's just not something that computerized AI can do. So think about a patient with nerve damage. They're in the clinic, they're relearning how to use their arm. So they're frustrated. They might even be in tears. A PTA can read those emotions. You can read body language. Obviously, the tears are a big red flag. So you can then pause the treatment and find a way to encourage the patient to continue. You're not going to get an algorithm that's going to look into a patient's eyes. So looking eye to eye and saying, I believe in you, let's try again. That's something that it can never replicate. Um, so another example could be a stroke patient with aphasia. They need a lot more than just exercise prescription. They need that human connection and most of the time on the fly creative modifications. And so that brings me to the point I have a nonverbal special needs client. AI could never replace me for that client. I use his body language, I use his mood as a way to communicate and further his exercise progressions, all that good stuff. AI could never replace that. I think, especially in special populations, um, that's just not something that's ever going to happen. The human physical therapist will always be the gold standard. So, a review by Krasovsky and Levin in Frontiers in Neurology 2020 asked if virtual rehab could replace clinicians. Their conclusion was technology can support, but human oversight is critical. The bond between patient and therapist directly impacts outcomes, and AI doesn't build bonds. We do. So, finally, let's talk a little bit about complexity. PTAs and PTs treat patients with various health conditions, often unexpected setbacks, and unique personal goals. We're trained to assess, adapt, and adjust within a moment's notice. So, for example, a patient that has, let's say, diabetes, back pain, and depression comes into the clinic. So, AI can absolutely generate some cookie cutter program based on the diagnosis codes, but the human therapist knows that depression is going to affect their motivation. Mood can affect motivation. And diabetes, that's going to affect the healing process. We're looking at the patient as a whole. And then their back pain, they're in pain. So that's going to change how each exercise feels. That's just not something you can reduce to an algorithm. That takes a human physical therapist or a physical therapist assistant. So Lynot's 2023 review made this point. Rehabilitation decisions aren't one size fits all. Nothing is really. Um, they require professional judgment that considers context, comorbidities, and the patient's daily life. You have to get to know your patient to give them the best rehab possible. So AI can give data, but PTAs and PTs turn that data into safe and meaningful plans of care. So does this mean AI has no place in our profession? Absolutely not. That's not what I'm trying to say. I absolutely think it would be a nice compliment. I think it's a tool that should be used in complement to a real life human physical therapist assistant or a physical therapist. So yeah, it can track progress with sensors. It can flag risks based on data. Most importantly, I think a great benefit of AI would be save time on paperwork. But AI should be used, like I said, as a tool, not a replacement for our role as physical therapist assistants. Just like an MRI scan is a tool for a radiologist, AI doesn't replace the PTA. So, can AI safely and effectively replace PTs and PTAs? All of the evidence says no. And I personally strongly believe that will never be the case. The ethical and safety challenges are far too great. The human connection and empathy and also motivation, they can't be replicated. AI will never replicate that. And the complexity of real world critical thinking is far beyond what algorithms can handle. There's just too much room for error to completely cut out a real life physical therapist assistant, and just rely on AI. So Manella's 2024 review calls for governance. Krasovsky's 2020 review proves that humans are still essential. And Lynot's 2023 review highlights the technical limits. So together, these sources remind us AI can help. It's a nice tool. Um, but PTs and PTAs heal.